Шановні пані і панове, 12 година, ми розпочинаємо нашу роботу.
Ladies and gentlemen, it's time to get started. I'd like to thank everybody who has joined us. So here is the deal. The UN produced an important paper which concerns deinstitutionalization. So this time we're going to talk about this. We're going to look into the updates on disability. We're going to learn from the people that are experts, and they're going to share their insights. So the ones that are not speaking right now, would you please turn their microphones off? So whoever who is not speaking right now, please keep your microphones off. I'm trying to keep this under control, but I can't really control it all the time. We're going to have the two working languages going here, English and Ukrainian. There's also a translation done by means of gestures. In the bottom of the screen, you can find the globe-looking button. By pressing that button, you're going to get English and Ukrainian, and you choose the language that is most convenient to you. So we've got simultaneous interpretation going here. So I think all of these interpretations will work out just fine. This event is aired via Zoom, so we capture a large audience. You can follow it on Equalympics TV channel, and that's another step towards disseminating knowledge and ideas on this important subject. Whenever you're speaking, I'd like for you to possibly turn on your cam so that everybody else can see you. You can put your questions in the chat box. You can also raise your hands. There is a function like that in the reactions section. So that's all about the technical and housekeeping points for this event. I guess it's going to be a fruitful and active discussion. So we're going to be looking into the UN updates on disability, deinstitutionalization in focus. I'd like to turn over to Murat Sahin, who is the acting coordinator of the UN. He also represents UNICEF in Ukraine.
Thank you. Good morning, all. I learned from Lina. It's a pleasure to meet you all. On behalf of the United Nations Resident Coordinator and the whole UN family, I welcome today's online presentation of the UN policy paper on disability. It's an analytical document created by all UN agencies, funds and programs in Ukraine, and aims to present a common approach on UN position on the situation of people with disability in the country. I'm glad today that we are joined by high-level guests, both from Ukrainian government, as well as other relevant stakeholders and civil society organizations, academic institutions, international experts, and experts by experience. We have selected today, because it's an important day, 13 December, for our presentation on to be symbolically observe the 15th anniversary of the Convention on the Rights of Persons with Disabilities, which aims to promote rights and well-being of persons with disabilities in all spheres of life. Our position and our conclusion in this paper presented today rest on the provisions of the Convention, which was truly a huge leap forward in protecting the rights of persons with disabilities. Its main novelty, for sure, was the shift to a human rights-based approach to disability. Despite presenting huge such historic paradigm shift, the Convention on the Rights of the Persons with Disabilities remains the most swiftly ratified international human rights treaty. The presentation today will be focused on our key recommendations from the paper, Deinstitutionalization. So, why do we consider it as a very important and timely to discuss the issue today? I would like to stress that roughly 1 billion people with disabilities in the world, and an estimated 2.7 million persons with disabilities in Ukraine. This is according to State Statistics Service of Ukraine, 1st of January 2020, which amounts 6% of the population of the country. However, actual numbers are likely to be much closer to international disability prevalence rate of 15%, as there is only scarce relevant disaggregated data available in Ukraine. People with disabilities are one of the most excluded groups in our society, one of the hardest hit by the pandemic. Even under normal circumstances, persons with disabilities are less likely to access services and to participate in the community. Their access to basic human rights, such as the right to health, right to work, right to social security, right to equality, and non-discrimination has been further reduced due to COVID-19 pandemic. People with disabilities are a diverse group of individuals with different identities, including various ethnic, religious, and racial backgrounds. They include migrants, refugees, asylum seekers, IDPs, LGBTI people, people living with HIV, young and older women, single mothers, and widows. Therefore, people with disabilities are often suffering from intersectional discrimination. Disability inclusion became particularly important during rapid digital transformation in Ukraine. The National Omnibus Survey conducted in September 2021 revealed that 17% of the women and men are not using digital services due to absence of any device with internet. Among those without access, 28% of those were with people with disabilities. These people are at risk of being left further behind as the country digitalizes. To reduce this risk, it is necessary to ensure that all digital transformations are comprehensive, inclusive. Attitudinal, environmental, and institutional barriers have amplified the health and human rights crisis for persons with disabilities in particular. Persons with intellectual and psychosocial disabilities remain the most vulnerable and neglected groups among persons with disabilities in Ukraine. This is due to their systematic institutionalization, stigmatization, and lack of guarantees of protection in specialized institutions. Whereas of torture and ill treatment continue to be documented. Due to lack of community-based services and supported housing, long-term care facilities for persons with intellectual and psychosocial disabilities remains almost the only option for permanent residence of persons with intellectual and psychosocial disabilities who do not have housing or relatives who can provide accommodation and care for them. Children with intellectual and psychosocial disabilities are particularly vulnerable to institutionalization in adulthood. Due to lack of education, socialization, habilitation, and rehabilitation services in children institutions, and lack of social housing for persons with disabilities discharged from the long-term care facilities for children. A high-level institutionalization, often combined with removal of restriction of legal agency, significantly influences opportunities for people with intellectual disabilities to get education and employment. At the same time, even in cases when such persons have access to secondary education and vocational training, they still face discrimination in employment. Apart from entrepreneurs running a social business, only a few major enterprises in Ukraine are ready to consider employing persons with intellectual and psychosocial disabilities living in their communities. As for people staying in facilities, such opportunities are even limited. Such situation contradicts the convention according to which all persons with disabilities have a right to live independently and to be included in the community with the freedom and to choose and control their lives. At the presentation today, we will have an opportunity to discuss key aspects to consider when introducing deinstitutionalization policies, complement UN country team policy recommendations, provide concrete suggestions on the steps forward to realize the recommendations outlined in this policy paper. Let me conclude by saying disability inclusion is an essential condition to upholding human rights, sustainable development, and peace and security. It is also central to 2030 Agenda for Sustainable Development to leave no one behind. The commitment to realizing the rights of persons with disabilities is not only a matter of justice, it is an investment in a common future. An integrated approach is required to ensure that persons with disabilities are not left behind. Disability inclusion will result in a better COVID-19 response and recovery. It will provide for more agile systems capable of responding to complex situations, reaching the furthest behind left. What is more, strong institutional support from the government organizations or persons with disabilities is crucial for ensuring the effective and meaningful participation of organizations or persons with disabilities, and for reinforcing the autonomy and freedom of persons with disabilities to make their own decisions during the pandemic and beyond. There is a need for the government to take steps to distinguish organizations of persons with disabilities in legislations and acknowledge their leading role among other civil society organizations that might be working for persons with disabilities, as required by the Committee on the Rights of Persons with Disabilities in its General Comment number 7 in 2018, and to ensure effective and meaningful participation for people with disabilities through their respective organizations in decision-making processes. The UN policy paper on disability, as well as other developed programs, policy papers, will be accessible for anyone interested on the UN in Ukraine through official Facebook page and also the new UN Ukraine official website, ukraine.un.org. Thank you for your kind attention and wishing you a fruitful discussion. Very brief remark at the end. I've been 4 months in Ukraine with UNICEF, and our office just became accessible for the first floor. Even the second floor is not accessible. So there is a lot to do for UN agencies, companies, and institutions to improve accessibility, but also include colleagues and partners to work in our own institutions. I'm committed to make UNICEF more inclusive. And Osnat Lubrani, our resident coordinator, is committed to make UN presence in Ukraine much more inclusive. Wishing a healthy and fruitful discussion. I look forward to listening to the remaining presentations. Thank you.
Дуже дякую, пане Мурате. Справді, не залишити нікого без уваги.
Thank you, Murat. Indeed, no one should be left behind. That's an important point. I have a couple of people that are called user and iPad. I'd like to possibly see your names, maybe second names. I need to know how to address you. So with this, we're going to continue and we're going to have it from the people which are the real experts working in the field, and they have the first-hand experience in things we're talking about. It's hard to tell a personal story within 7 minutes, I understand that, but we need to make sure everybody else gets the idea. So I'd like for you to possibly use no more than 7 minutes. I'd like to have it from Irina Yeremenko. She's the acting director of Borodanska Psychoneurologic Boarding School. Hello. Our boarding school is a municipal agency. It houses 355 inmates. 276 are people with steady psychological disorder, 79 our geriatric patients. The key priority in social services like this is to enhance the social support and protection of rights of patients. In order to develop social services for people with mental disorders, we have intense care units, social medical correction, palliative care, supported living, and social rehabilitation. Under the law on social services, the Ministry of Social Policy Ordinance number 429, there's a classifier of social services which allow us to improve the practices in offering these services in order to prevent complicated life circumstances, to minimize those circumstances. There's ordinance issued in 2021, number 3801, carries a list of social services that we offer. I'd like to tell you about the routine which we use in offering social services. Assisted living for the elderly, for example, and people with disabilities. In that case, the providers seek to help these people to develop skills in order to take care of themselves and also other skills necessary for independent living. They also aid them in organizing their daily schedules. So providers of social services allow the patients to get a better idea of roles, and they know how the kitchen works, they know how to maintain domestic appliances, they get a better idea of how to cook things. And at the end of the day, they end up being able to cook some meals and they can speak with each other. The most popular service is social rehabilitation for people with intellectual and mental disorders. We've got a psychological support service offered by professional psychologists to organize cultural, leisure, sports events, artistic events, labor adaptation, work therapy, and art therapy. These experts seek to help people create their creative skills, cognitive skills, self-implementation. In 2020, one of our patients, which is a painter, took the first place in the Pan-Ukrainian competition. Another patient, which has serious physical disorders, makes painting with the help of his feet and teeth. In the Athletic Rehabilitation Center for people with disabilities, we offer games of soccer, table tennis, chess, and drafts. It helps people improve their health. According to the Health Ministry Ordinance number 1778, and according to individual rehabilitation programs, which belong to individual files of patients, there is a way for the patients to do these kinds of things in order to maintain their social and physical activity and to exercise the rights to full-blown living. And we allow them to enjoy all of that. 13 people have been able to get a job, a half-time job inside our institution. They take care of the grounds around the asylum. They work in a little farm where we have some cattle. That was an experiment, and I think it's been a positive one. The patients that have gotten a job have been able to become a significant part of society. They could see the responsibility they take over. They enjoy working there. They think of it as a pride. We cannot employ all of the patients, we just cannot do it. The management of the institution took this matter up with the local employment center. Unfortunately, because of the physical conditions of these people, not all of them can be employed, especially if people have mental disorders. Our patients are in good physical shape, and there is a labor adaptation instructor that allows them to work better. And this will allow them to believe in themselves. They will be able to speak with the people outside the institution. They would be able to grow professionally. They would not feel anxious or alone or depressed. It would allow them to enjoy and live to the full. I have spent half a year in this institution, but ever since I came here, I could see that we all are like family. The staff, the patients. To many patients, our staff are like their families, relatives, and parents, and they have become like our kids and friends and relatives. The government is taking care of the patients of our institution, but it cannot fully replace the family. So patients are enjoying good conditions here. They get good food and treatment and entertainment, but they all need to get some communication outside this institution. They would like to have somebody like a buddy they could share everything with them, their emotions, their success stories and failures. I wish we had the volunteering service, which would allow them to speak with somebody over the phone at least, so that patients would feel needed and significant in this life. You've got 1 more minute to go. There are certain issues with the society right now. These people should not be neglected, they should be considered as equals. Doctors need to know that when the patient needs to go to the hospital, very often doctors keep sending them from post to pole, and eventually they go back to us. And if they come to us to get a health checkup, one doctor has been able to take care of 40 patients in an hour, and she could say that she did everything according to the rules. So we had some other doctor to do the checkups because we could not believe she had done a good job. The office where it's done is on the second floor. There is no elevator in the building, so we cannot check up the bedridden patients. We try to get some private clinics to help us with that, but all of this should be well thought out at the national level. And there was one negative case. We have a Facebook page where we share the experiences of our institution. There was a dancing battle, and we took pictures of that and share it in that page. But then we came in for a lot of criticism. We had to remove all of this information to keep the patients from getting those offensive statements. I think changes should be made to the staff. We need an in-house lawyer here so that we could quickly respond to certain incidents like this. We also need this lawyer in order to help patients regain their capacity to work. We need to see if some of the caretakers are doing wrong things, capturing the property of these patients. We need to have more social case workers in the institution like mine. They will monitor many of the patients that leave our institution. Services, funding, and capacities in the institution will allow the patients to feel like a part of the family here. All right, thank you. But I have one question for you. You say that patients are enjoying working and they take pride in that. What do you think about that? How does that make you feel? I'm always happy to come to work, and I'm always happy seeing the patients because they have become like one big family to me. There's my son in this institution too. I only have one baby with the cerebral palsy. He used to live at home, but he needed communication and he wanted to get transferred to the institution. So a couple of years ago, he ended up in this institution, and I came to work here half a year ago. Thank you, Irina. That's quite a personal story, and I have also heard some specific proposals. Let's have it from Irina Deshvar, the activist, and once again, those that are named user and iPad, please give me your names.
Всім доброго дня. Мене звати Ліна. Я громадська
Hello, I'm
організація
Lena.
у сфері захисту прав дітей з
I'm an
інвалідністю.
activist in protecting the rights of children with disabilities and
Чому я
institutionalized
обрала
children.
в житті? Тому що я
I have chosen this
проживаю
because
в інтернатній системі.
I have spent 12 years in the boarding school, and
Види інтернатних закладів.
I have been to many institutions
Будинку інтернату, який
from
знаходиться в Адмінсоц, це в Олешках.
a very young age,
І я прекрасно знаю на собі,
and I perfectly know what it's like
інтернатних закладах 19
to be there in those institutions, to spend 19 years living there. Before me, there was later speaking about the psychoneurologic institution, but I also work with the institutions like that. And I cannot tell you that everybody in there can enjoy living there, thinking that it's like a single family. I can tell you that many of the rights get breached, especially if you speak about psychological bullying or things like that. When I was institutionalized, I was 8 or 9 years of age at that time, and I remember they took all of us to the camp, and I was left behind in the room in the institution because I was a kid with disability. So everybody else was healthier, which is why everybody enjoyed the summer holidays, and I was kept inside the institution because of my disability, and they didn't want to carry me around because I would give them a bit more trouble. Well, over time, I got transferred to some other institution where all the kids were with disabilities, and I only have a physical disability, and it's not too bad, but still I have an intellectual capacity. So in that boarding school in Kherson region, I have been able to learn. At the same time, I could see some other units where they had about 200 kids, and they had more complicated cases, like each of them would have a few diagnoses, like a mental, a physical disability, mental disorders. And I was always surprised because I could see that I could learn. I would go abroad, I could go out for some sports. I finished high school, I got my certificate, but there were other kids on the second floor, and those did not learn. They didn't have any red letter days to celebrate. They didn't go to the seaside or to the riverside. So that's the kind of discrimination I have seen in the boarding school when I was 14 to 16 years of age. So nowadays, I speak in favor of the deinstitutionalization reform, and I know what I'm talking about. I have spent 6 years touring the boarding schools, and I have some secret agents, kids among the patients there, and they share with me the photos which illustrate the violation of human rights. So while I'm speaking, I can get a video or a picture from them indicating a violation of human rights. Recently, I got a call from one kid from one of the boarding schools, and he says, "Lena, I have a birthday today, and they made me go and work taking care of the pigs in the pigsty." So he says, "I'm having a birthday today," and they say it's work therapy, and there is such a thing in the boarding schools, but it should not start at 6 a.m. and finish at 9 p.m. So in this regard, there's a need to see what we're talking about. So we're talking the institutionalization, which is inclusion and service provision, like multidisciplinary services. I really hope that in this country, they will stop writing strategies and they will start doing something, acting on them, creating social services. I work with Bachta Sercem NGO, and we offer a socialization service for adolescents and youth with complicated disabilities. There is a school contact, and every day we reach out to every kid. They have a mentor, and we help these kids socialize. So we can help these kids gain new skills. They will be able to pick up a spoon and hold it in their hand and eat. I remember a couple of years ago, a guy came to us who could not speak. He had a palsy case, and this guy could not hold a spoon in his hands. In 3 years of spending time in our school, he can hold a spoon and eat on his own. And he can speak as well. He can tell everybody else what he wants. He can speak his mind. And that's a good development. my organization, and not just mine, there are many other people joining this call that do socialization for kids with comprehensive disabilities. Well, I like what they're doing. Some kids and youth do not have to be institutionalized. They don't know what it's like to be there, what it's like to get their rights breached. They know what it is like to have a family. They have a right to have a family. They are sons and daughters that are loved, and they grow up as personalities in that setting. Well, thank you for your attention. Hopefully, over time, we're going to be able to see how to do the institutionalization, something that's going to be a real deal, not just something written on a piece of paper. Thank you. I appreciate your story. Just one question. In the end, you spoke about these kids and youth that don't know what it's like to be in the boarding school. So I think you are speaking about the personal stories of these people. But if we think about it broadly, is there a need for these people to know what it's like to be institutionalized? I guess initially we need to pursue a particular policy. Maybe we should do more campaigning. I'm one of those who used to be in the boarding school, and I can start talking about that. And most of the people with disabilities that have been there could also speak about that. They could do it together. They could help the government, the MPs, in offering the best possible service. And then that's going to be a real help. Because in terms of campaigning, institutionalization does not seem to be a big deal right now. So there are issues that are higher in priority list. So we need to speak about that so that other ex-patients of the boarding schools could also go ahead and speak and let everybody else see what it's like being there. I can see a hand from somebody whose name is Nadia, and you're going to be able to speak over time. But right now, according to the agenda, we're supposed to have a panel discussion. And maybe that's where we're going to find answers to the questions. The panel features 6 panelists, experts. They've got their own experience working in this field. All right, folks. We've got a time limit, so I'd like for each of you to speak no longer than 5 minutes. And if it keeps up like that, we're going to be able to hear everybody else out, and then we're going to have some time for questions and answers. So, top 3 barriers to deinstitutionalization in Ukraine, top 3 steps to be taken to accelerate deinstitutionalization. So that's the topic for the panel discussion. Valery Sushkevich will speak first. He represents the National Assembly of People with Disabilities. Thank you, dear colleagues. Dear UN representatives, UNICEF representatives, I'd like to thank Ms. Lobrani and Mr. Murat Sahin for inviting me to join this discussion, this panel. It is the 15th anniversary since the UN Convention on the Rights of People with Disabilities has been adopted, and with the help of UNICEF, this country has been able to promote the equal rights and opportunities for people with disabilities in this country. Speaking of the deinstitutionalization policy, it's hard to speak about everything in 5 minutes, but I've got some updates that I wanted to share. Valery, I appreciate that. So you can take a bit longer, but even then you have to talk shop. Okay, let's go back to some statistics. In 2020, every day you get 26 kids that lose their parents. That's about 10,000 per year. And these are the ones that have been seen by the government. According to experts, you get another 15,000 kids per year that are off the radar. And I've got some more updates to give us a better idea of where it's at with the institutionalization in Ukraine, in the institutions where you get kids living there around the clock. You get about 90,000 kids living there. 95% of them have parents. So you have to get that. Merely 19% out of them are with disability. Everybody else is not with disability. That's also an important factor. So all of that suggests that the share of kids with disabilities found in institutions smaller, like 19%. Effectively, the kids with disabilities have 10 times stronger likelihood to get institutionalized than that of kids without disability, because right now there is nobody else out there to offer educational, rehabilitation, and medical services to the kids with disabilities. I also believe that kids that have parents are supposed to be living in families if you get appropriate conditions, if it's a safe place for them. If a family isn't fit for kids residents there, or there are no relatives, then these kids should not be institutionalized. They should enjoy a family form of upbringing, adoption. They can have a guardian or something like that, a trustee, family home types of institutions. That's what we can think about. I'd like to also share a point which is valid in terms of institutionalization. We should not speak about removing the institutional care as such totally. We need to create an educational system which includes care and upbringing, which will work appropriately, and it will come to replace the institutional settings over time. It will replace the institutional care. The families in need of assistance will get the assistance so that kids could live there. And other organizations in this field should get support from the government and community so that in future they will establish this kind of system. They need financial support in the first place, and kids should go to the regular educational settings once that system has been up and running. If need be, in the inclusive groups, kindergartens, and schools, this thing can be practiced. But there is one more thing that I would like to add to this. It might be different from most of those who speak about the institutionalization. So I'd like you to get a better idea of that. I believe that kids which have multiple complicated disorders, I'm not speaking about all kids with disabilities, but the ones that are having multiple disorders, they should attend specialized educational settings, at least for now, because in this country, inclusive education is only nascent. So if we establish appropriate conditions for those kids in regular educational settings, then that would be the way to go. So over time, I think it's going to happen, and these kids will go to the regular schools, not inclusive settings. I'd like to share some of the information that I got from the colleagues from UNICEF and the UN. So we speak about this analytical report. It says that kids with disabilities keep facing significant obstacles towards high-quality inclusive education because of negative social standards and behavior, limited capacities of schools, and limited capacities of teachers. Teachers often cannot offer support to the kids with special education needs, especially if they have severe disability and retardation. So these teachers cannot offer enough services to them. In between the schools and inclusive resource centers, these links are weak, and the use of assistive technologies in the education sector is little practiced right now. That's what I can see in the analytical report we're discussing today. Even in advanced countries of the world, there are institutional settings for kids which have multiple complicated disorders, and that's where They gain access to education and other things related to rehabilitation and medical assistance. Ukraine has decided to get rid of those special institutions. And in doing so, it did not set up appropriate living conditions for these kids where they are found. And that's the key problem. So, Andrei, you spoke earlier about three main obstacles to deinstitutionalization. So, lack of social security, including social services. Number two, poor supply of medical and rehabilitation services. And lack of appropriate learning conditions. We have ignored these factors and we did the easiest thing. We just shut down the boarding schools. That's the easier way to go. I mean, destroying is much easier than creating something. You get reports that show you how many boarding schools have been shut down. And all of that is done on time. All of that is done well. But at the same time, nobody offers social, medical rehabilitation services and inclusive education options. Back in 2003, me and my colleagues supported the law on social services. They keep speak about the need for the services, but back at that time, the budget code did not carry enough funding for that. So some funding is there, but there seems to be no funding for social services. And it's been like that for many years. Sometimes parents keep calling me from across the country and say, the boarding school is about to be shut down. Our babies used to go there. But in the other schools that are fit for kids with disabilities, there are no appropriate conditions for them. Teachers do not know what to do with these kids. At the community level, there are no services for these kids. So parents say they're going to have to quit working in order to take care of their kids, but they will lose the source of income. The aid from the government is too small, and you have to go through a lot of bureaucracy in order to get some. Well, Valery, I think you have been able to make a strong point. So you're almost out of time. Let me just say the last point for now. It's been quite a discovery to me to see that while Yanis McDavid was visiting, that's a motivational speaker from Germany, he told us about the same problems in Germany. The parents out there are not happy with what the government is doing. The government out there does not financially support the families that take kids from the institutional care. So that problem is not Ukraine specific. It is found in Europe, in the world. Deinstitutionalization needs to seek to allow opportunities for kids with disabilities inside the existing institutions and outside them. Well, thank you, Valery, and we can look into the practices of other countries and we can learn something from that. I'd like to turn over to Tatiana Barantsova. She is the government commissioner on rights of people with disabilities. Hello. I agree to all of that, and I can add by saying that I've got lots of updates from parents, and sometimes one of the parents has to quit working because family takes care of rehabilitation and other social services. Many families cannot afford all of that. They just cannot pull it off. So that's why they choose to get their kids institutionalized. Sometimes parents believe that some of these services could be covered by the state. I'd like to add a few points to what has been said so far. Speaking of social services, well, they are drafting social standards and the way in which social services can be delivered. But the question is whether communities are ready to provide these services. We can see there are lots of people, lots of adults that cannot get those services. They do not have a social worker, which is why they call us. So some people live in the villages, they call us and say, there is a bedridden person here, there is no social worker, nobody to take care of that guy. Also, there is a lack of experts at the community level, which would help. We do not have enough speech therapists, psychologists, other experts and medics. And that's where it's at across the whole country. We could think of motivating the future teachers in order to make progress along these lines. The same happens across the institutions and boarding schools. They have a sheer lack of these experts there. Parents say they hope that their kids would be getting better service inside the institutions. But according to the Office of Government Commissioner on Rights of People with Disabilities, I have visited many institutions and they can see that kids seem to be doing fine there. Those buildings are heated and there are other conditions in place, but no early interventions are ever undertaken. So institutionalized kids cannot get those kinds of services. And kids find it difficult to adapt to that setting. Some of the 18-year-olds could get a better care, they could learn and so on. If they're orphans, they get transferred to geriatric institutions, and that's where they do not have options. They cannot see a light at the end of the tunnel. So we have to do everything we possibly can to make sure that these kids stay with their families. But also, the kids that are institutionalized right now should not waste their time there. So we need to review their rosters and staff. Sometimes there is one shrink or one speech therapist for 80 kids, and that's too much, and that one expert cannot take care of so many patients, no matter how hard they try. Individual hygiene equipment is largely missing in the institutions. Those that take care of little babies seem to be doing better in this, but those taking care of adults, they didn't have this. We need more speech therapists, shrinks, psychiatrists, and the like in order to take care of those kids. They are needed in the children's and adult boarding schools. We know institutions where no athletic events happen at all. There is nothing doing there. The boys would like to play some soccer, but they cannot. We need to offer training to experts. In some of the institutions, we can see kids in wheelchairs, and they're not sitting comfortably there, and that's why they develop some of the diseases. Sometimes the wheelchairs are not fit for their age or their condition. And the decision on the wheelchair is made by the neurologist or a psychiatrist, but that expert does not know what type of a wheelchair would be best for that particular patient. They just don't know what types are there in the country. So we need to take care of that. We also need to practice assisted living so that youth would gain a better skill and they could possibly get unemployment in order to enjoy living in the community, living it to the full. Thank you. Thank you. Tatiana has been able to speak about a comprehensive solution, and with this, would like to have it from the international institution, Naira Vatisyan. She runs a program for protecting children representing UNICEF.
Good afternoon, dear partners, distinguished colleagues. Actually, I'm Chief of Child Protection Section in UNICEF, and I had been working for UNICEF for more than 20 years in different country contexts, including for supporting different programs for children with disabilities. And it's difficult to talk about the situation in Ukraine after partners already mentioned some statistics, but one remark about this. I mean, regardless of the development of the country, institutionalization depends on mentality of children. It not only depends on the availability of social services. And so what we witness in Ukraine is, first of all, a situation when for almost 70 years during Soviet period, a state was the main guardian for all children deprived of parental care and children with disabilities. So people were used to heavily depend on institutional care. As a result, what we have, even after several years of independence during transition period, there were little efforts made really to strengthen the family, to strengthen the services around the family, having a child with disability. And instead, we continue to heavily rely on institutional care for children with disabilities and people with disabilities in Ukraine. In addition to statistics brought by Valery, I would like to add that unfortunately in Ukraine, institutions are used as state strategy to mitigate not only disability, but also to mitigate poverty, to mitigate migration, etc., etc. So by the end of the day, what we see is that the overall child welfare and social protection system is not well equipped to be proactive rather than reactive. So we wait until the problems happen. We wait until the family has a child with disability and they don't know where to refer this child for services, where to get early intervention services, where to get quality medical rehabilitation, where to get the early inclusion. And then, of course, the only solution for those families offered by communities is really to transfer the child to special boarding school, because by the end of the day, this is where majority of families can get some kind of quality, good education. And this is a major barrier to overall deinstitutionalization in the country. So what is really critical is to see that the system is changing its attitude, and people and professionals working with families having a child with disability or family member with disability are changing their attitude, behavior, and their overall understanding of social norms. Because what we see in general in Ukraine, we still have medical model of disability prevailing over the social model of disability. And very often the access to services, referral to institutionalization heavily depends on medical diagnosis of the person. So I will try to be as brief as possible and to come up with at least 3 proposals how to address institutionalization. And the first one would not be developing services, because the others mentioned about this. I would say the first one should be changing the attitude, knowledge, and behavior of people and professionals on disability, because people should really understand that a person can be born with some kind of impairment, can acquire impairment, or can acquire some limitations, functional limitation because of accident, etc. But whether the person will become disabled depends on us. It depends on professionals, on family members, on community decision makers. If we are really able to remove the barriers around the family, around the child, around the person with disability, then this person will feel as full member of the society. And partners just mentioned the recent speech by Yanis, who is a motivation speaker about disability rights. And Yanis grew up in a foster family, and family was the one empowering him really to achieve his best. Through making sure that the community is more accessible, the barriers are removed, the barriers to services, the barrier to education, and that he's empowered enough to feel as able-bodied person with equal rights and equal opportunities. I think this is number one that should be addressed in the country, and we should start from decision makers to service providers who work with those families.
Ms. Avetisan, you have
yeah.
only 1 minute for the other two.
Okay, I'm almost done. The second one is, of course, to promote the continuum of services. And when I mean the continuum of services, it's not just about social services in support of families. I mean, there is a lot that could be prevented when we talk about early childhood disability, because there's enough evidence showing that in majority of cases, when children have impairment and you have early intervention services, you have early identification system in place, then in 80% of cases, this child will not develop further disability. So having prevention, early identification, early intervention as a key national strategy. And then, of course, different kind of social services, family support services, daycare centers, quality medical rehabilitation, etc. And inclusive preschool and school education is the second recipe for that. And the third, and of course, it's really critical because even if we talk about the best institutions, there's enough evidence showing that even in the best institutions with the best caring staff, there is no enough attachment, there is no enough child stimulation. So child will not develop to his, her own full potential as this child will develop in a loving and caring family, be that biological family or alternative family for those kids. And the third one I would suggest is to think of deinstitutionalization plan for every single child, because the deinstitutionalization reform, the way it was done in Ukraine, almost the third attempt failed, is because it never had an individual plan for each child, for each institution. So we should start from individual deinstitutionalization plan for the child, and it should be, first of all, return to biological family where it's possible. If not, then refer this child to alternative family-based care when it's possible. If not, for children with multiple disabilities, there's also an option of community-based care in small institutions. I would not say I'm fully against this, but having in mind the Ukrainian context, I can see that there's no other option. But never to live in a huge residential care institution. This is not a solution for children. And of course, effort should be made to transform majority of those institutions into integrated social service centers for people with disabilities and families. I'm done. And I think this was missing in our plan because people in Ukraine understood the institutionalization as closure of an institution. In majority of neighboring European countries, what happened, majority of institutions were transformed into services.
Very specific proposals. I think that they are really aimed at reaching the best results. І тепер ми... Дякую, пані.
All right, thank you so much. So with this, I'd like to turn over to Larissa Samsonova. She's the government expert on preschool and inclusive education. She's with the Directorate of Preschool, School and Post-School and Inclusive Education, Ministry of Education and Science. So please remember there is a time limit because otherwise we're not going to have enough time for questions and answers after the panel. Hello, dear colleagues. Thank you, Andrei, for moderating the session. I'll be brief. What we're discussing today are very important issues, and it's hard to briefly describe everything happening in the ministry. Since 2017, they adopted a new education law. It says that every child can attend an educational establishment nearest to where they live, and parents can choose where the kid will be learning. And that turned the situation around. In 2017 and 18, they stopped keeping this network of medical and psychological consultations. So on the medical basis, they would see which institution is best for each particular child. So right now we have a new network of inclusive resource centers. It is still in the making, I would say, but it works at the community level, and this inclusive resource center is a municipal agency which takes care of 7,000 children in villages and 12,000 children in cities. And that was a starting point for changing the situation around in inclusive education. We still have a lot of obstacles in the way. This system has a lot of inaction. We have more than 14,000 institutions, educational institutions, all in all in this country. And 50% of the institutions have inclusive classes. I'm sure over time things will get better, and every school in this country will soon become inclusive because they're going to have a kid with disability attending it. So we seek to improve the quality of inclusive education. There's a state service for education quality in this country, and it's got regional offices. In each region of the country, you get the offices of the service. The Ministry of Education and Science work with them. We try to look into the problems they are experiencing as they practice inclusive education. And that reminds me of the barriers. Changes are being made to the regulations, but those in charge of the educational settings are sometimes unaware of that. So the State Service for Education Quality looks into the developments at the local level, and very often the school principals are unaware of the changes that are happening. They are unaware of the new regulations. They do not know that they have to abide by those. So there is a lot of inaction in the system. We keep trying to keep those guys up to date. We offer training to them. We've got offices in each region, as I said. We train some of the national trainers, which will offer advanced training services to the administrative staff of the educational establishments, because they are the key people which will lead to inclusive education. So they work with the principals of schools, and then the staff of all of those schools will get the idea and will work accordingly. And the whole system will contribute to the interests of the baby. There are also mental barriers, especially in the adults in this country. You have a lot of stigma, myths, and misconceptions, and that gets in the way of the inclusive education. We need to keep telling everybody which offer services to inclusive classes, and we need to let these people step into the shoes of every kid and see what it's like and how important it is. Lena referred to campaigning, and I think that's one of the ways of getting things done. We need to showcase positive benefits from inclusive system for the entire community. It's not just a benefit to the school running the program. This benefit will go to the entire society further on. Inclusive resource centers lack teamwork. There should be a team around this kid offering the best possible benefit to it. But within the existing regulations, it's hard to do it. There's going to be a pan-Ukrainian conference on the 17th. It will address inclusive education, and at that conference, we're going to tell everybody that resource centers have to promote rehabilitation services. They have to check with the educational establishments They should help the staff and the kids to get the services organized to benefit the kids primarily. So we're going to keep on training the experts in order to make them work as a team. We also need to build inclusion to prevent institutionalization. And it's going to be a natural development for inclusive education in society. We're going to create this inclusive space, knowing that institutionalization is not going to be an option there. And the parents will be able to make a better choice. They will choose a regular school nearest to their place, but that school will be able to offer quality service. All right, thank you. You spoke of the individual plans. And on the other hand, I could see teamwork, which was Larissa has just told us about. So there are different ways of taking care of this thing. Joint efforts, that's what it takes. I'm turning over to Tatiana Simonenko. She runs the Department for Exclusive Extramural Education. She's with the Directorate of Preschool and School Education and the Ministry of Education. So Tatiana, oh, she's not there. Well, I think Larissa has told us a lot about that. I'd like to add just a couple of words. They keep saying that we're shutting down the specialized educational settings, but we haven't seen a change in this number. Not too many of those have been shut down. The Ministry of Education has produced some regulations which will influence the situation, and there's going to be more clarity of doing this. There are new regulations on special educational settings, and they mention the categories of kids that can attend them. So these are the kids with complicated disorders, and they should enjoy high quality service from those establishments. And these establishments are found in large cities typically, and the experts working there also live in big cities as a rule. And that's why there is lack of experts elsewhere. Okay, I understand it. There's an active discussion going on in the chat. Lena refers to one factor, which is so important. It trumps many regulations, I would say. But still, I'd like now to turn over to Viktor Ivankevich, representing the Human Rights Commissioner on Equal Rights and Freedoms.
Шановні колеги, я дуже радий представити.
Dear colleagues, I'm happy to speak for the Secretariat of the Commissioner. I'd like to say hello from the Commissioner. She was supposed to be taking part in this call. This time we're speaking about non-discrimination against people with disabilities. Well, indeed, these people are worst hit by discrimination, followed by the elderly people. They also suffer from that. In particular, we're speaking about deinstitutionalizing care for children with disabilities, and there should be a logical ending to this effort. Right now, we don't have a 100% inclusive space or setting. So many of these children stay with their families, and at least one of the parents would have to quit their job in order to take care of the kid. We need to reach 100% inclusiveness. We need to understand it in full. Until then, many of the children will be sitting at home watching things happening out in the street, but they have no way of being a part of those developments. They cannot get out in the street on their own. They cannot speak and have something together with the kids of their age. They cannot go to the library, they cannot go to the school, because physically they won't be able to make it there. So we need to create this conducive environment fit for people with disabilities. It is also important to make sure they communicate with the outside world. You get people in wheelchairs, and also you get many people that cannot hear, and some can only speak using gestures, sign language. Some people have visual impairments. So the government can create a better space for them. And this should be well understood by the people that do not have any disorders, disabilities, and the like. They do not experience any such problems on a daily basis. If we don't see people with disabilities every day out in the street, in pharmacies and institutions, in shops and stores, then something's wrong with the society. Instead of specialized institutions, we want for these kids to be in the family environment, in the family setting. And that sounds like a good idea, but one of the parents will have to quit a job, and this should not affect the family financially. This family should not slump into the low-income bracket. The government aid should be ample enough to allow the family to define, although only one parent will keep on working. We also need to develop the daycare services to families like that. And these agencies or institutions should be found in every quarter, well, in every block of the city, or they should also be found in every village. Kids and people with disability, all in all, should not experience multiple discrimination every day. All right, thank you, Victor. In particular, I appreciate you saying that it's not just about the kids. You also say that many people have disability, other disorders, and they experience similar problems as well, and we need to know about that and respond to that. I'd like to have it from Ruslan Kovbasa, General Director of the Directorate of Social Services and Child Protection, Ministry of Social Policy. So Ruslan, over to you. We didn't seem to be able to get connected to Ruslan. So I think everybody has been able to make their points, and sometimes we can see different ways of addressing the problem, but still they might be mutually augmentative, I believe. And also, there are a few people that seem to have questions right now. So Nadia is the first on the list, so please give us your question briefly and tell us what you are. Thank you. I am in Kramatorsk in Donetsk region. Nadezhda Polomarchuk. run the Donetsk-based NGO of people with disabilities. I have been in this movement for 30 years. When they started doing the inclusion thing, Maria shared her works with us. It was like a thick book. And under that inclusion concept, no school seemed to be able to do it. So I started questioning the inclusion concept because it seemed to be off limits to most of the kids. And also, I can see that many of the boarding schools actually belong to the Ministry of Education. And in the boarding schools, people are not taught anything. They don't know how to sew a button, how to manage a budget. So they get out of the boarding school, they buy apartments for them, but those are really very dilapidated apartments and they cannot be fixed up. So we as NGOs teach these people how to do things outside the boarding school. And I appreciated the point from one of the people who spoke earlier. It was about the need to train the people in charge of the institutions. So these people should be trained regularly. Well, thank you so much, Nadia. Just one more thing. All right, but just one. I remember a baby who was born without a leg and a hand. At the age of 2, he got transferred to the other group, the group of mentally impaired kids. And that baby used to be so active, but after spending some time in that group, the baby was no longer active. It was just sitting around doing nothing. So there is a way to rightly determine the disability in every particular baby, and it takes to have knowledge and a particular attitude to this thing. Okay, thank you. And with this, we're going to have it from Igor Mashnichenko and Oksana Solomi. And that's going to be the end of the remarks. And I apologize to Natalia, but she was slightly late. So Evgeny and Alexander, you have 1 minute each. Thank you for this opportunity. I have a question for the Government Commissioner on People with Disabilities, Ms. Barentsova. My question is about a potential deterioration of the armed conflict in the East. There is a convention, UN Convention on Rights of People with Disabilities, and comments to that. So among other things, that speaks about protecting and enabling safety for these people in Ukraine at the time of the humanitarian emergencies and armed conflicts. It's about evacuation of these people from the war theater. What is your question? Well, Tatiana, could you tell me if the government will take steps to evacuate people with disabilities from affected areas? Okay, I think we can easily say yes as a way of responding to this question, but Ms. Barentsova will speak later. So, Ms. Suleiman. Hello, dear colleagues. I also appreciate this opportunity. I can add something to this discussion. You've got 1 minute. Speaking of social services, I can tell you this. We agree that there's a need to develop better social services at the community level. Right now, all of that is done at the expense of local budgets. It is a good way of supporting territorial communities. As they keep practicing these innovations, there is a need for a budget program to cover it. This year, 20 communities enjoyed financial aid. Next year, there's going to be more funding for that, 100 million to support the communities, offering 7 services for the institutionalization reform. There's one more project supporting territorial communities. It offers aid in consistent social work. It includes early detection of vulnerable families, and communities will be getting some assistance from us. Thank you, Oksana. I appreciate your point. I'd like to have it from Natalia Головко now, because there is some time for it. Thank you. I don't have a question. I'd like to make a remark. I'm Natalia Головко, work in Vinnytsia, Association of Assistance to People with Disabilities called Відкриті серця. I work with the National Assembly of People with Disabilities as well. I have listened to everybody, and I can share my idea of this. There is certainly a need to set up community-level social services, and some intense work has been done by NGOs, jointly with the Ministry of Social Policy. We need government support for community-level territorial services. The local budget cannot cover all of this. There's going to be too much for it. Not too many territorial communities can pull it off. In terms of deinstitutionalization, I guess we need to make a list of indicators which would allow the management of the institutions to see what they should do. So as well, they need to see if they are doing deinstitutionalization or not. And these indicators should be a part of the ordinance of the Ministry of Education or Ministry of Social Policy. So it's not about getting better funding or offering better pay to the staff. There should be other indicators which will be relevant to living conditions. Okay, thank you, Natalia. I get your point. And there is somebody else who has been able to raise her hand, Irina Humanuk, representing the Institute of Legislation of the Supreme Council. And that's going to be the very last remark. Turn on your microphone. Well, you get a lot of draft laws from the Cabinet of Ministers on inclusion and social services. They also address guardianship and trusteeship for people that are found in the working group. There are comments that I have taken on board, and I'm going to share them with the working groups. Everything that has been said will also be reported to the working group by me. I appreciate all of those points and comments. I have taken a note of all of them, so I think the working groups, drafting laws, will take them on board. Speaking of employment, there is a draft law which addresses employment of people with disabilities. It goes beyond quotas. That's a very complicated draft, and we keep working on that. Everything that has been said today will be duly taken on board. I appreciate all of those comments. Thank you, Irina, for supporting the cause and the hope that in spite of heavy odds, we're going to make it happen. We're going to look at some questions, and okay, we have had some questions, and I'm going to have Natalia Barentsova to try and respond to them. We've got about 9 minutes to go.
Пані Тетяно,
So, Tatiana,
пані Тетяна відповість на це пізніше.
I think she will speak a bit later.
Пролунали, прошу учасниці і учасників дискусії прокоментувати в межах.
So let's see if anybody wants to make a point. It's going to be 1 minute and a half per point. Valery Sushkevich, you've got your 1 minute and a half tops.
Я хочу сказати ще раз. Я вважаю, що
I'd like to say once again, I believe that deinstitutionalization is the key factor. And secondly,
три моменти, кроки, які прискорять
I can think of 3 steps to make this happen sooner.
що торкається на шляху до інституалізації, щоб не
We're gonna do everything to make sure it's not gonna harm the children with disabilities.
інвалідністю, що то торкається отримання всього того, що торкається виховання, освіти.
They need to get education, upbringing, and support.
Треба покращити той рівень, який сьогодні є. І третє,
There's a need to improve today's practices and also
виходить з інституційного догляду, зробити
everybody who leaves institutional care should have a roadmap,
опрацьована система,
and that roadmap
варіант. Ми
should
прибираємо
be
інтернат.
developed consistently. So there's a need to see what's going to happen to this guy once they have left institutional care.
Підвести до школи. Чи школа є архітектурно доступна?
We need to see if existing schools are architecturally appropriate for these kids. Are there teachers who are going to be able to teach the kids with special needs? How should they handle these kids? They need to know that based on their particular disability.
Є асистент дитини.
Are there assistants to those teachers, assistants to those kids?
Скажімо, група продовженого.
Are these kids stay longer in schools after the end of regular classes? Are there rehabilitation services and other services in the region for a child with disability? Thank you, Valery.
Ларису, пані Лариса Самсонова.
Let's have it from Larissa Samsonova now.
Так, я тут. Будь ласка.
Підсумки, хвилина.
Хвилину.
We've got a minute to do a kind of a wrap up.
Підкреслю, що ми на правильному шляху, що Міністерство освіти і науки
I think we are on the right track. The Ministry of Education is not steering away from it. In fact, it tries to make sure that inclusive education become a better deal in this country. We keep working with NGOs and other institutions, international institutions, in order to make it all happen. And inclusive education should become a benefit to everybody. Mr. Ivankevich, over to you.
Шановні колеги, я хочу ще раз підкреслити, що
Dear colleagues, I once again would like to say that
цих всіх проблем, їх дуже багато, залежить від кожного.
there are lots of problems and
Кожного із нас
we all can contribute to a solution to them.
ці проблеми
We need to find a way to make people around us aware of potential solutions. We need to make sure they know what they can do in their daily work in order to produce benefits to the people with disabilities. Mayor Avatasyan, you're welcome now.
Пані Наїра.
Naira,
She has obviously left. В будь-якому разі її пропозиції були цікаві і
but anyway, she shared interesting proposals.
Я звернув увагу на те, наскільки
And
зацікавлена
I have noted that she was interested in that and she knew what she was talking about. Well, people looked at the existing problems in different ways. They have different backgrounds. They
головного, на їхню думку, напрямку.
try and think of the main thing that should be done in order to accomplish
Підсумків.
this deinstitutionalization. I'd like to turn over to Lena Deshwer to do the wrap up of the entire session. She has been so active in these discussions and her mimic and gestures would speak for themselves. So it was easy to see if she was supportive or not supportive of something. So you wrote, among other things, the need of political willingness, and you made it a big point. So to me, political willingness is something that is uncertain, and they say, we haven't been able to do it because there was no political willingness. So tell me what you mean by political willingness in this setting, and who would you get it from?
Да, я зрозуміла, дякую. Дякую за запитання. Ну, перше, я хочу підсумувати все, що сьогодні, ми обговорили.
Thank you.
В першу чергу,
Yes, I'd like to make a few points to wrap it up. We have to
завдяки цим
remember the rights of a child with disability. Based on that, we can think of multidisciplinary services, social services, so that a family which has a kid with disability or without disability, if this family is facing some trouble at the community level, there would be assistance for this family, and the family will be kept together, and the kid could be institutionalized or would be able to enjoy these services in some other way. Speaking of political willingness, it's not about politicians or incumbents. It's about willingness of each individual. Like, we want to go ahead and do something. It's not just to draft a law. It should be something going beyond that. People should be willing to get something done. The families which have a kid with disability or a family that is in scrutiny, in trouble, facing some special circumstances, well, we need to organize care and social services for these families and children. Dr. Kabel, representing Ukrainian Catholic University, Mariana Onulfrig, they also took an active part in the discussions, and there have been other people that joined this thing. And one more point. Valery Sushkevich has responded to the statements in the chat. And still, I can see he appreciates the point that has been carried in one of the statements in the chat box. Well, it's been important to listen to you guys. Maybe not all of the questions have been answered, but the chat keeps going, keeps working, and there will be answers to your questions after this session. So with this, we're not ending this discussion, we're just ending this session. In the UNDP Ukraine website, you're going to get the UN analytical report on disability, which is what we have been discussing today. So with this, I'd like to thank you all. I'd like to thank the interpreters, the sign language and the simultaneous interpreter. So let's keep on it. I'd like to thank the UNICEF and the UN for being on it all the time. And I'd like to thank everybody who contributes to more success in resolving this problem. I'll see you around.
Дякую всім за участь. До побачення. Гарного дня.